Hello, and welcome to the inaugural episode of AI with GennAI. I'm your host, Jen Gennai. We're going to be talking to the experts in AI and generative AI that you need to know. We're going to take a socio-technical and human-centered lens to understanding the world around us as we develop and deploy AI and generative AI as responsibly as possible. I've worked on responsive innovation for almost 10 years at this stage, and I'm still learning from all of the people you're going to hear over this summer series. And with that, I'm delighted to welcome our inaugural guest, Dr. Ivor Horn, the sought-after advisor, investor, physician, and technology executive with experience in entrepreneurial, venture, academic, health system, and research organizations. Dr. Ivor Horn most recently served as founding director and chief health equity officer at Google, where I had the pleasure of working with her. Before Google, she was chief medical officer at Accolade, acquired by Transarent, and previously was professor of pediatrics at the University of Washington School of Medicine. She currently serves on the boards of Boston Children's Hospital, Care Academy, and Accolade. Dr. Horn, thank you for joining us.
Thank you for having me.
Before we get into some of the deep questions around AI and responsible AI, tell us what's behind the bio. Were there any particular triggers or information that led you into human-centered technology?
Yeah, Jen, thanks so much for asking the question. I'm a physician by training and a pediatrician. And what really triggered me in thinking about technology, particularly at the intersection of health and technology, was a patient encounter and really an interaction with a parent. My parents were back then bringing their flip phone to me saying, Dr. Horn, I know my child is running around right now and looks great, but here's the picture I took last night on my flip phone. Here's the thing I recorded. Here's that cough and what it sounded like last night. And it was this aha moment for me that they were using these as tools to really communicate with me. And so I really became interested at that moment in how can we build a tool and how can we help the patients and the families that I was serving who were really from historically marginalized communities who didn't have as many resources or as much access to physicians or caregivers to say, how can we use technology to help this be a better experience for them? And so that was the trigger for me. It was, as always, my patients and families said, we're using this already. Can people build it better for us?
I love that you're starting from a point of how to help other people achieve goals that they're already trying to solve for themselves, but maybe not in an optimal way, either for themselves or their outcomes or the families around them. Describing it as a tool, a communication device that these technologies really are supposed to be helpful to all of us. They're not just shiny objects that should be helpful to a few or make us either more human, more connected or otherwise, but obviously they come with challenges in themselves. So I love that human-centered start. Thanks for sharing that story. I think it is a good segue into our first segment is what we're calling the T3 trio. And these are a standard set of questions we're asking our guests to really show our audience how different experts think about the world around us and what we're building. And you've really shared an example there of how people are already trying to use these technologies to help them in their day-to-day lives. But how do you see AI shaping either the healthcare industry, pediatric support, or the world more broadly? Where is AI you see it most shaping?
Yeah, I will say there are a couple of areas that I think about. Obviously, I think about healthcare. I can't help, that's what I do. It's who I am. And I also think about education. So I'll start with healthcare. We make this assumption because when we think about AI now more broadly, people think about generative AI. But AI has been used in healthcare for a very long time, machine learning and predictive models, where we've made these predictions around the best thing to do for care and what we should do. And there have been studies that have shown that those predictive models can actually worsen health outcomes and can worsen disparities. And so for me, the concern is that we don't replicate that in this next stage of innovation and development. And so I am optimistic always in my belief that we can engage and improve the way that we do healthcare by using AI in a way that is inclusive, that thinks about including the community, including populations that weren't necessarily included as we developed during the Internet of Things. When I started this journey, I hadn't really thought about Silicon Valley very much. I was on the East Coast in Washington, D.C., but I became passionate about, I want to go out and have these conversations to say, build for my patients, build for the people in the communities that I serve, because they're using this technology. They're thinking about it in really amazing and great ways. They just don't necessarily have the access to the latest and greatest innovation. For healthcare, we have the opportunity both to make healthcare more efficient, more effective, and utilize it to address some of the administrative issues that take away from the doctor-patient relationship or the caregiver-patient relationship to increase that human interaction to actually make healthcare more human-centered. And so that's one of the pieces that I think about.
I love that you're seeing a bit of the optimism behind this technology in terms of making it more inclusive and fair, because so often we hear, and obviously a lot of my focus is on AI risk management and ML fairness, that this technology can and will be exclusionary if we don't take deliberate steps. But you're calling out the counterpoint, which is we could use this technology to be more inclusive, more fair, because humans have always been biased, but at least now we have a lens and a tool to identify those biases and hopefully mitigate against them. Is that right? Did you hear a bit of that optimism there, or tell me more?
Absolutely. Learn from what we haven't quite gotten right in the past so that we intentionally, I say there's an importance of being intentional about addressing these issues. Oftentimes we run from it because we say this is going to make it harder. It's going to take longer. Actually, the correction of it takes longer. And that part is really harder, and the risk of people being harmed during that process. And I think we can do better if we work towards it and if we're intentional about it. The second piece that I'll say is it really democratizes our opportunity for health. People now have the ability to ask questions in a way that the way that they put that question and the way that they're thinking about it. And the ability to allow people to have something explained in terms and ways that they understand is really powerful in making sure that we address the biases that create those risks during this process is really important. And the way that you do that is by making sure that you're engaging everybody in the process. And then the second one that I talked about was education. I remember when Khan Academy came out, and I was a pediatrician, and I had parents in my clinic who were struggling with, how do I help my kid with their homework when there are lots of things that I don't know? They're like, my parents got to a stage where they were like, we can't, we're good. Like, this next phase that you're doing, that's beyond us. And for the parents in my clinic, I'm like, this is a free service that you can use to help your kid move forward. And the ability to personalize that education to help them through all of those stages, to me, is a very powerful opportunity for us to both democratize both healthcare and educational opportunity to communities, to people, to populations. So those to me are the optimistic things of how I think we can and should shape the future and leverage AI to do that.
That's great. And you've certainly chosen some of the biggest, most important challenges, education and healthcare, and how AI can be useful there. But obviously, technology companies, healthcare companies, educational institutions can't do this alone. And given the recognition of the risks here, what do you think are the greatest ethical or regulatory challenges of achieving these positive goals? Where do you see those tensions?
Yeah. I think the biggest ethical challenges that we have, and the regulatory piece is another part, but I'll stick with the ethical component to it. I think we think about fairness and bias in technology. And when you talk to a technologist, when you talk to a developer, fairness means that my product performs the same for everyone. When we have disparities and when we have inequities, like fairness, gives us level playing field. But we have gaps that people are experiencing. One of the things that we worked on and had a conversation about was the difference between fairness and equity. And it is really important in this moment that when we talk about the ethical challenges that we have moving forward, we have to talk about equity, and we have to understand when we're building a product for fairness versus when we're building a product for equity. If we're building a product in health that is fair, but those who are experiencing the worst health outcomes, if it's not closing that gap, there's the risk that just because it performs the same, it could broaden that gap as
Mhm,
opposed to closing it. We don't want it to be worse for people who are doing well.
mhm.
Yet we want to be able to close that gap. And I think that is the important piece, that when we think about ethics, we have to think about equity as part of our ethical responsibility when we're building AI.
And thanks for breaking it down in that way, because I know there is a lot of discussion around fairness, equity, inclusion, either how they're all lumped together, but also how to tease them apart. So I think it's very helpful to have that distinction and know what our overall goals are. And to your point, it's not about making anyone's experience worse, but it's about closing that gap so everyone's experience can be better. Really love that. So as we progress and tackle these ethical challenges, we aim for these more inclusive, optimized, efficient futures, as you say, in education and healthcare. What does that future look like? What will 50 years from now, if we continue on this path, do it responsibly, hopefully achieve those goals that you laid out, what does the future look like in 50 years to you?
Yeah. The future, I hope, looks like me on a beach somewhere. What I hope for is a democratization of access, a more equitable environment where each person has the opportunity to have their best outcome. That's going to be different. Like, what I define as my best life is different from what you define as yours, as it should be. But having the opportunity for that and having access to the tools and resources that we can provide using I think is critically important. And not just here in the US, but around the globe. And we being intentional, and I'm hopeful that we are really thoughtful about the risk for harm to people and working really hard to address that in every way that we possibly can, both as organizations, institutions, companies, and as individuals. I want it to bring back humanity as opposed to worsening humanity. So that's my hope. My concern is that we risk worsening disparities, and we worsen divide, and we create a tiered system of access to resources and access to opportunity. And that is my concern. So I sit in this space of recognizing the both and, recognizing my hope and my responsibility to really move towards achieving that hope.
Yeah. No, that really resonates with me as well, that a lot of the work that I do in responsible AI and responsible innovation, some people can perceive that as like, oh, you are scared of this technology. You don't want this technology to be successful. And it's actually the opposite. I really want this technology to be successful, to be beneficial, to allow us all to live more full, more connected lives. But it won't happen unless we're deliberate and thoughtful about getting there, that we're managing these risks. And so, yes, like it can be perceived as I'm spending all my time on the negatives and the harms, but that's because I believe in the promise of the technology, but also know that unless we take these deliberate steps that we can not achieve that. And so I share that tension as you described that. I want to hope for the better future, but as we've seen in the past and as we know from human, whether it's biases or limitations, that we need to be in it together and to be very thoughtful about that. And that leads to the next segment as we're talking about the future, that we're already living in what some people had perceived as the future, that we're using chatbots to have conversations, we're using chatbots to help us think more creatively or to answer questions that we have every day. So we're living in that future for many people. And our GennAI Lens is a way to bring that future more immediate to ourselves and our audience. So what we're going to do, it's both a mixture of a little game and question time, that I've used generative AI to generate a series of questions for you. There's one set that is more AI and technology related, and then another set that's more personal, diving a little bit deeper into those biographies and drivers of the life that you lead. So we'll have two related questions, but we'll start with a bit more of the AI and technology one, where you'll just simply choose 1, 2, or 3 of which question that you're willing to tackle. What are you feeling right now? 1, 2, or 3?
I'll start with 2.
2. AI bias tradeoff. Given that all AI systems reflect human biases in some form, would you prefer systems that are transparent about their biases but less accurate, or systems that are highly accurate but with hidden, unexamined biases?
Oh, wow. You come with the tough questions, like right out of the gate. Okay. I have to say, transparent about the biases, but less accurate. And that may surprise people, in partly because it's about trust. And we build trust both when there's transparency and when people know that things are not quite complete. And I trust someone when they share their vulnerabilities with me, and it gives me an opportunity to actually sort of make my own assessment. And when it comes to technology, when we have something in the background that says it's highly accurate and it's hidden an unexplained biases, however, like what is it hiding your perspective or is it hiding my perspective on biases? Like I want some autonomy in making that decision. And there was recently a study that talked about people who leverage AI tools more frequently use less critical thinking skills. And for me, I really think it is important for us to maintain those critical thinking skills. When we get a tool and it says, here's the answer, we haven't used our critical thinking skills to think through and problem solve. And it is really important that we do that problem solving. I'll give an example in healthcare. When we're thinking about something in healthcare, when I'm using generative AI to create a summary of a visit, it is my responsibility, like the result of that summary and what goes in that chart is my responsibility as the physician. In the end, I am accountable for that. So it is my responsibility to still do that review, still make sure that content and that information is accurate. And so for me, it's like it creates some efficiency. Absolutely. 100% appreciate the efficiency. And I also want to make sure that I'm using my critical thinking skills to make sure that I'm providing the best care for my patient, that all of my years of learning that may not have come out in that handwritten information, that I'm applying that expertise in making those adjustments. So I don't want us to lose that perspective. And so for me, like having the transparency to say, yes, you know, if I see something that's blatantly inaccurate, I'm going to be much more critical than if I say, oh, that sounds right, that looks right. And it is actually inaccurate. So for me, that transparency so that I can identify those biases is of value.
Well, I think that people may be surprised to hear a physician and a health expert saying, I'll take a little bit less on the accuracy to make sure that it's fair. But I think your description of how important transparency is very much shone a light on how that's an appropriate way to think, that transparency builds trust, but it also allows for them understanding, fixing, and being able to add more color to a situation, especially in the 2 areas that you've discussed most today, education and healthcare. This is about people. It's about their experiences. I'm still not on the boat that even highly accurate AI is going to solve all of these education and healthcare issues, because there's humans. These are life-changing situations. Right. How we get our education, what we learn day to day is who we will be, what we will know in the future. Obviously, healthcare, life or death situations, improvements in quality of life. Accuracy there is not a standalone value or outcome. It is in the context of how people are living, how the doctor is leveraging their expertise to lead to better outcomes. So yeah, thank you for sharing how you kind of break that down, because I think it will catch a few people by surprise.
I'll give you another example. I think it's really important as a physician, when I am giving a diagnosis, if I'm giving a diagnosis to a patient, it is their decision on how they manage and navigate that. I don't have control over that. If I tell them what to do, if I only give them one perspective on it, without giving them the full perspective, they get to decide based on their values and based on like their lived experience and what's going on in their life. And I think it is really important when we give information that is highly precise, highly accurate, and optimized for the perspective of the people who built the model, that may not take into consideration that person's experience and that person's values.
Yep. No. And it's hugely important to do so. It's a holistic approach to it, certainly. Yeah. Okay, well, thanks for playing the first question. Now we might get to the spicier one, which is the personal one. So again, similar to 3 other different questions here. How are you feeling, 1, 2, or 3?
I'm going to go with 3.
3. And this one is about value evolution. How have your core values around technology changed since you first entered the field? What caused this evolution, and which of your past beliefs now make you maybe slightly uncomfortable?
So I have to say my core values haven't changed. However, my understanding has evolved. And I'll say this because, I came from an academic environment. I'm a physician, and there are biases that we as physicians have. And I came into medicine sort of recognizing that. And so was always sort of pushing against the physician as the all-knowing person. And I think for me with technology, the reason I sort of made that leap is because I fundamentally believed that technology was going to transform healthcare. And that was a long time ago. That was before electronic health records, before people really appreciated the role that technology could play. And I fundamentally believed that even though I didn't fully understand the potential of technology, I just knew it was something that I wanted to get into my patient's hands. What's evolved is this importance of that, still fundamentally making sure we do that, but having sort of behind the Iron Curtain, so to speak, of really the importance of change within the community of what's being built in technology, and the importance of the voices that are in the room, not just in the use of the technology, but in how it is built and how we can make it better. I didn't fully appreciate, I just wanted it to be leveraged. I just wanted the access. But the potential for how much it could be better by different voices and different perspectives and different experiences. And that part for me was really important. Sort of what makes me uncomfortable is I feel like now I'm part of that group. I'm part of that technology group. And what makes me uncomfortable is our resistance to actually doing that. And it's almost a fear of why not? Like, why not? It's sort of my discomfort is the risk that we will remain in what has worked for us in the past when we need to think about how do we do things differently moving forward. I think that's true for tech, and I think that's true for healthcare as well. And that widening of the gap in sort of our hunkering down concerns me. I think we try to go deeper and deeper and deeper without sort of going broad.
It's really interesting, and what a thoughtful response. If I was asked that question in return, I would need at least 5 minutes to sit with my thoughts before I could say anything as thoughtful. So, and I think it's massively important. And I also like your call out near the end that, like, where we are ourselves in either these institutions, these systems, these roles, and even that can change over time. Because I agree with you, our core values generally don't and shouldn't change over time. That's why they're core values, but our interpretation, our iteration of how we live those values can certainly change. Recognizing our changing role and how those values manifest in different ways, I think is massively important. So thank you for sharing that. We're already getting close to the end, and I know the listeners and audience will want to know, okay, so what does this all mean? How has it looked for you practically in your experience? Either you've tackled a difficult problem, you shared a founding situation with a family, but is there another example of how you've had to put some of these kind of deep thoughts into your work, into a specific use case that might help our audience feel that it's a bit more tangible for them. Any example or case study you can share with us?
Yeah, I think one of the examples that I'll give is sort of, and this is something that you've experienced too in the work that you did with the AI principles, is how do you build a resource that can be leveraged to scale a technology across, like, I'm a physician, I'm not an engineer, I'm not a product manager. And how do you build a resource for all of those people who are on the team who are doing this work to allow them to scale their work, to create efficiency, but in the language that they need and the problems that they're trying to solve to get to the outcomes that you're hoping for in whatever that product may be. And so for me, building out that resource within a company that is global and that can scale. So how do I put health equity into the mind of the UX researcher, the engineer, the design team, the marketing team? Like, how do we do that across a company? Because you can't be in all places at all times. And so for me, like, doing that work of saying, how do we create a tool that does that was really an important use case for me. And it came from actually something that was built and then got a lot of press that wasn't the best press around the tool that was built, and it needed to be improved. And then how did we go about improving that? And for me, the question came of, we can solve this problem. And it really was around derm. It was the original derm launch. And because the original study did not include darker skin tones in the appropriate numbers. And I went to a team and I said, we can, like, how do we do this? And this is a question that we had in healthcare for a really long time. And one of the things that I loved about the folks that I worked with, they said, I think we can solve this problem. And they went about it. And because engineers think differently and product managers think differently than physicians or researchers do, and it's all of those groups that came together with their different perspectives, even though they didn't have health equity experience at all before, but knew that this was the right thing to do. And it took us and we had a dermatologist who came in and helped. And it resulted in this paper, the HEAL framework that we created, and it was published so that we could share that out. And these were folks who did their 20% time. And I give credit to those Googlers because they said, we think we can do this and we can solve this problem. They took the time to do it, and they did that project and then shared it with the world to say, here's a framework that you can use and that you can leverage using data methodology that is way beyond me in the research that I do. And so for me, that use case of saying, this didn't go very well, let's create a solution so that we can address it in products moving forward, and let's share it with the world so that other people can apply that tool. And so for me, that was the best use case, because then we could take that experience and apply that to how we could give, like, key tools and key guidance and resources for folks across a team of how to do that moving forward in different products.
I appreciate that that's not just a specific example of how technology can be useful, and obviously had this noble goal of being able to identify any issues with skin. Also, this kind of mentoring lens of, we learn from our mistakes. You said that it didn't work as intended at the start, and it was about, how do we fix this? And just recognizing that, and that's part of responsibility, is accountability, taking accountability and figuring out, okay, how do we fix this? And do we have the right people in the room? To your point, it wasn't just about darker skin tone people, it's also about expertise of who is in the room. Is it engineers, product managers, or otherwise in that room who are able to come together and help? When we started work together at Google, we were in different organizations and trying to figure out some of these very complex issues, both knowing that we agreed on an overall goal, but we have different backgrounds, we have different experiences. How do we bring those things together? And it does get to better outcomes when people are able to, I'm a big fan of debate and hashing things out. I think either constant agreement to me makes me fear what's not being said. Like if people aren't disagreeing,
Yeah.
then if we really are agreeing, if we're not nudging a bit on that, the importance of that kind of humility to address challenges, but also the openness to bring in that diversity of thought, experiences, expertise to get to better outcomes next time and share those learnings. That was another thing that stood out from your response there, is not just doing the work, but then sharing it with either other people internally to help them avoid maybe some of these mistakes, but also externally helping other people kind of stand on these shoulders of big tech to say, we don't have to start from the start. How do we build on each other's knowledge to get to those better outcomes quicker, faster, more effectively, and more inclusively as well? So a lot there from that case study. So we'll end with, what can our audience do today, tomorrow, to either be more responsible, consider some of these thoughts? What are either a tool or advice, any top tips to leave our audience with?
Oh, is this my my three things?
What are we'll start with your tools. There's a bit
Okay.
of technology there. We'll have some technology audience people. Let's start with tools and then we'll go with tips.
Okay. So I'll start with a tool that I feel like I'm a lifelong learner. And so I'm constantly trying to learn about new things. And there is this tool that I learned about, an organization, a nonprofit called Humane Intelligence. And they have a platform that they leveraged early on. And amazingly, they were able to get many of the technology companies allow them to use their foundational models and to do red teaming of the models. And at that time, it was with developers, and it's to assess bias and fairness as part of the models. What's so powerful about it is that they've now been able to transform that so that lay people like me, who are not developers, can actually assess a model for fairness and bias, and identifying what are those particular areas, whether it's gender, race, ethnicity, or geography, whatever those cases may be, to be able to do that testing. And I think being able to improve on those tools so that we can bring more community into our process. Because oftentimes when we're thinking about technology, for us, it's efficiency. We want to move fast. We want to, we want to test the model and move the model fast. So building tools that allow us to engage the community, engage the end user more efficiently and more effectively, to actually do some of that red teaming in the real time. And it doesn't have to be for the big model, because I think sometimes we have this expectation of doing things for foundational models that I don't think is fair to the folks who are building the foundational models. But for organizations, when they're fine-tuning those models to apply them to their population, how they can engage community that they're serving to improve and make that model and make that tool more effective for the folks that they're serving. And so for me, that's the tool thing, which gets me to my three action items, because you and I talk about action. Like one of the things that I love about working with you, and I loved about working with you, is like, you are so action oriented. You are like, okay, what are we going to do? And then how are we going to do it? And now let's move to do it. So the first thing for me, the three things is, first is governance structure. I have had the privilege, and I feel it is quite an honor, to sit on boards and to be able to have been the child of a patient, a medical student, and a resident, a physician in a health system, then a physician in administration reporting to a board, and now being on the board of a children's hospital. Like, that for me is super, like, mind-blowing in so many ways. But it has, for me, made me appreciate the importance of governance structure and having teeth in that governance structure to hold people accountable at each stage around making sure that we're intentional about how we build and what we build, to hold ourselves accountable to our values and to the mission that we're driving. So for me, like, thinking about governance structure, and particularly in healthcare, where we sort of separate the data scientist into that research group, and the technology people are just vendors. They are, they're not part of the team, but they really are part of the team now. And so thinking about that in terms of governance structure, I think, is really important. The second thing is really prioritizing engaging the community as part of the process. And that's where these tools and things like that make that more efficient becomes more important, but really prioritizing the community, because we're going to build better products and we're going to build better solutions if we do. And lastly, integrating equity by design and holding ourselves, our teams, and our people accountable for doing that.
Wow, they are great. And yes, as you started, obviously you spoke to my head of my heart to say that governance is your top one there. So you're really leaving our audience with practical things that they should prioritize. And even the tool that you suggested, humane intelligence, I believe, we'll include that in the show notes afterwards with the rest of the content here that we may have mentioned. But it's great to have things that people can do tomorrow, already think about in their day-to-day work. Learned a lot today. Thank you, Dr. Horn, for taking the time, sharing not just your practical expertise, but obviously your journey and your path there as well. And obviously there you ended with your path to being on a board and the steps that happen in between, and hopefully inspiring other people of the journey that we're on and the technologies that we can use to get there is vitally important. So really appreciate you taking the time today. And so for all our listeners, thank you for joining. As I mentioned, you'll find the details in our show notes. I'm Jen Gennai. I'm your host. Looking forward to seeing you in our next session. And remember that the technologies that we build today are what our future will look like. So let's build responsibly. Thank you.